All right, you guys. Well, thank you again so much for inviting me into your living rooms today. I wanted to talk about nutrition and healthy blood. I think, we really do overlook blood, but it is the liquid of life. So I wanted to talk about how we can actually keep it healthy. And it looks like some other people are starting to join on. So come on in. All right. So what are we going to talk about today? We're going to talk about, what exactly is blood and what does it do for body. And we're going to talk about the dangers of unhealthy, and we'll learn about the foods that keep our blood healthy. And I know it sounds like almost like a weird topic, but without healthy blood, we're not going to have healthy tissue, not going to have healthy organs, and then our health is going to fail. So blood obviously is vitally important for the body. We without it. And it is a pretty thick substance, believe it or not. It's actually thicker than water, and it is warmer than our body temperature. So it's over 100 degrees Fahrenheit. How much blood you actually have depends on your size and your weight. And that would make total sense because a person was 300 pounds next to a person that's 100 pounds. Obviously, the person with 300 pounds has adapted to create more blood vessels that would demand more blood. So that does kind of make sense. But on average, 5 to 6 liters of blood is what we have. So blood is so important because number one, the function is transportation. So transportation of what? We've got transportation of oxygen, transportation of CO2 out of the body. We got the transportation of nutrients, vitamins, medications, amino acids, carbohydrates. So it's going to be transporting all the things that we need to live, to grow, to reproduce, etc. It also regulates. What does it regulate? It regulates our blood pressure. It regulates our body's pH. And any disruption of that causes severe illness. I have some patients that have kidney disease. And once you have kidney disease, unfortunately, it really throws off the whole homeostasis of your blood, changes of your blood. It's actually called metabolic acidosis. Um, well, certainly blood is going to protect us. How does it protect us? Well, it's got the white blood cells, and we have to really keep our white blood cells very healthy in this day and age, especially with COVID and everything else that's out there. Where is blood made? Blood is actually made in several places in the body, but the bulk of it is actually the marrow. And adult bodies, bone, the blood is made in the pelvic area, the breastbone, and the bones of the spine. And it's really interesting because we've got lymph nodes, we have something called the spleen, and even our liver regulates the production, destruction, and differentiation of blood cells. So how important something like that is. If we have liver damage, if we have cirrhosis, if we have fatty liver, if we have high triglycerides, which actually, hurts the liver, if you had an I'm back. It looks like the internet is not cooperating today. But let me get my screen back up. All right, you guys, we're back. Okay, so as I was saying, there is hormone that actually regulates and promotes of red blood cells. And that's actually a hormone called erythropoietin, and that's created and made in the kidneys. So think about it. If you have any kind of kidney disorder, that can cause anemia as a secondary problem. Cytokines stimulate the production of white blood cells or other chemicals that actually signal the production of white blood cells. So I'm going to show you a little bit more about that. So these are the components of blood. We've got those cells, we have red blood cells, we have platelets, which are responsible for blood clotting, and then we have plasma. Plasma is that watery stuff that all of these cells float around in. Now, the white blood cells are extremely important, and they're so pretty. Look under the microscope, seriously, when you put certain dyes on them, they kind of look like this. And they have big nuclei. That's what these things are. And they're segmented. They're just really pretty. And this one's the erythrocyte. This is a red blood cell, and it kind of looks like a donut. We call it a bi disc. And then you've got these platelets that just look, they almost look like amoebas. Just look like little cell fragments. But these white blood cells are just so fascinating because they each have different responsibilities in the body. Now, when you get your lab tests done and your wellness exams, usually doctors will order for a CBC, which stands for complete blood count. And that's going to include how many white blood cells you have, how many red blood cells, plus your hematocrit. I'm going to show you that in a second. Your platelets. And, you know, it's really important to get your CBC done because that can indicate if you have a risk of anemia. And if you do have anemia, what kind of anemia? So we're going to talk about that in a second. It's important to also monitor your platelets. Platelets are extremely important because God forbid you cut yourself or you get into an accident, you need to clot your blood. And that's the major role of platelets. So this is actually of one of my patients I wanted to show you. This is when I see the CBC, it gets me very excited because everything is within a normal range. So depending upon which lab, they're always going to give these reference ranges here. So what I look at specifically as a nutritionist, I'm going to certainly look at the white blood cell count because I know that's involved with immunity. So if I see a low white blood cell count, number one, I'm going to be concerned for the patient from a medical standpoint, but also from a nutrition standpoint, I'm going to try to promote foods that really strengthen that immune system. Red blood cell count. So this is this range, which is really important to see something called hemoglobin and hematocrit. The hemoglobin is that molecule or protein molecule catches iron, and this is what's found in the red blood cell. It's so important to have hemoglobin in range, so we know that people are carrying the oxygen and they have enough in their body. And these are just, this just stands for mean corpuscular volume. It shows you the different sizes of the cells. Platelet count, this looks normal. And then what it does is it differentiates all the different white blood cells. So the neutrophils, the lymphocytes, monocytes, eosinophils, neutrophils, lymphocytes, monocytes, etc. So let's just take a look at the white blood cells first. Our lymphocytes are amazing. And thank God we have them because they differentiate into something called the T cells. And the T cells and the B cells are both lymphocytes. The B cells make antibodies. And that is just such an area of interest right now, especially for those of us that have gotten vaccinated. Are we making antibodies against the COVID vaccine, et cetera? The T cells create different lymphocytes called the T killer cells and the T suppressor cells and the T memory cells. And they're really amazing cells because they're going to scavenge around the body and really attack those creepy crawlies and viruses and bacteria. And then you've got the monocytes, which is actually the first part of this whole cascade. The monocytes are specifically called macrophages, and they're the coolest cells. Seriously, if anybody remembers biology, and we were taught about those amoebas, those single-celled organisms that kind of move along in the fluid. All right, well, a macrophage is not an amoeba, but it almost looks like one because it scavenges around the body to look for cancer cells, parasites, viruses, bacteria, toxins. And when it actually finds it, it engulfs it, almost like that engulfing something. And once it does that, it sends that signal to the T cells, hey, help me, I need here. And it actually signals the whole cascade of the immune system. So the macrophages are an extremely important cell of blood, of the white blood cells. Now, neutrophils are a special white blood cell that will respond. It's one of the very first cells that will respond to some sort of inflammation or bacterial infection. The eosinophils are really amazing because they'll respond to parasite infections. And I remember I had a patient who actually had malaria, and her eosinophils were through the roof. So it just goes to show that it really, really signaled those eosinophils to start attacking those malaria parasites. Basophils, they were of an alert. The basophils actually secrete histamine, and it's the histamines that causes those runny noses, itchy eyes, sneezing. So it's a little annoying. And that's why we take antihistamines to kind of shut down that whole cascade. But as you can see, the white blood cells, there are many different cells. They have specialized functions. And there are a lot of cells because it's so important to have a very strong immune system. We don't live in a sterile environment. And as you can see, outbreaks happen and pandemics happen. And imagine if we had a weakened immune system. That's why some of this COVID-19 affected some people worse than others. So what happens if your blood overall is unhealthy? Well, certainly poor immunity, that makes sense, but also tissue death. Now, why is that? Well, red blood cells carry oxygen and nutrients. So if you healthy blood or you don't have enough blood, your tissues aren't going to proliferate and live. That could lead to heart problems, kidney problems, respiratory problems. And really, when you look at all the organ systems, it could be a problem. I put here in with a question mark obesity because that's my field of interest, and there is some evidence to show that if you have something called sleep apnea, which is trouble breathing, especially at night. Think about that. You're really not oxygenating your blood. So you got your blood circulating, but it's not carrying enough oxygen. Could that actually be slowing your metabolism? So it really is a hypothesis that some of us are looking at. It's pretty fascinating. So I'm not going to go too deep into this, but certainly when we look at some problems with blood, we're always afraid of those cancers. And leukemia is a blood cancer, and you have different categories. You've got AML, which is actually the most common type of leukemia in adults, and it does affect the white blood cells. Then you've got the acute lymphocytic leukemia, which is what's commonly called the childhood leukemia, and it does affect those lymphocytes. So again, the white blood cells. Then you've got CML, which is the chronic myeloid leukemia, which is more common in older adults. This one's a little less understood than the other ones. And then you have chronic lymphocytic leukemia, CLL, and that's the most common type of chronic leukemia in adults. So as you can see here, all the leukemias actually, leuko is the medical term for white. So leukemia is a blood cancer of white blood cells. But let's look at some other common blood disorders. And I think the most common one related to nutrition is anemia. Now, anemia is just a generic term. It just means that we're not making enough red blood cells. And it can be caused by many different things. Maybe we have a protein deficiency, maybe we have a vitamin B12 deficiency, maybe folic acid, vitamin E, iron, or copper. So these are the most common nutrients associated with the health of your blood. So if we're deficient or suboptimal in any of these things, it could affect our blood in a bad way. And that's not a good thing because, again, if we're not making enough red blood cells, we're not oxygenating, we're not carrying the appropriate nutrients, etc. So there are many different symptoms of anemia. The most common one is fatigue. You just feel malaise, you don't feel well, you just don't have that energy. But also, anemia can lead to low blood pressure. It could be dangerous too. I have a patient, actually, I spoke to him yesterday. His blood pressure was 66 over 46. Can you even imagine? Normal blood pressure is about 120 over 80. So he was feeling really, really terrible. And what's interesting about this particular patient is he is going for a kidney transplant. So he's on dialysis. So his kidneys are not functioning well. He has anemia because he's not making that erythropoietin, that hormone. So he's got some, other underlying conditions here that causes this problem. Hopefully he's going to be getting on that transplant list. What else can happen? Well, if you have anemia, it can actually hurt your heart. I actually have a patient that was so anemic, it actually induced a heart attack. It was terrible. His hemoglobin and hematocrit were stress on his heart, and he actually had a heart attack. He did live, thank God, and he's better now, but that was a pretty devastating thing that everybody had to go through. It can actually, anemia causes an enlargement of the spleen, and that's because the spleen is becoming enlarged because it's trying to manufacture those red blood cells and becoming very enlarged in the process. Shortness of breath. When you actually look at somebody, you can actually see how pale they might be. They might even have yellowing too, even gray. I've seen some patients, their skin almost looks gray. So who's at risk? Well, you know what? Is at risk. But there are more people that might be at a higher risk, certainly for those of us that still get menstrual cycles, pregnant women, babies, and infants. But look at this. If we donate our blood too frequently, you can actually become anemic. I actually work with a group of patients that have something called the gastric bypass, which is a type of bariatric surgery, and they can't really absorb iron well, so they are at high risk of anemia. So I always tell them they can't give blood at least the first year after surgery, and then when they do want to give blood, maybe once a year because they're already behind the eight ball. Certain athletes can be at risk for anemia just because athleticism, their body is demanding so much more oxygen, which means they're demanding more blood, which means they have to make sure they're being able to produce it. Vegetarians are at risk of anemia because it have, say, a vegan who does not eat any animal products. They are at very high risk of a B12 deficiency. If you get a B12 deficiency, you can get anemia. The elderly, certainly as we get older, things don't absorb like they did originally. Maybe our intake has changed, so different things contribute to that. Alcoholism, certainly if we drink too much, that means we're not absorbing our nutrients. And sometimes if we're drinking, that means we're not eating. So we're not really nourishing our body. And other conditions like GI disorders. So if you have ulcers, have bowel issues like Crohn's disease, if you have celiac disease, even rheumatoid arthritis, all these diseases can actually affect our blood and our nutritional intake as well. Just wanted to show you this picture because this is classic case of iron deficiency. These aren't true of my patients, but I've had patients that actually, when I take a look at them, because I do a visual assessment, I always look at the nails. And if I see something like this, that could indicate an iron deficiency or even a vitamin A deficiency. And also, you want to look at the tongue and the mouth. That's why, the doctor is always saying, okay, stick out your tongue and go ah, because we're actually looking at the inside of your mouth, your tongue, and things like that. This is actually called atrophic glossitis, which is this is actually a severe case of iron deficiency. All right, so what nutrients do we need in blood? Well, water. Now that would make sense because I just mentioned before that plasma is 55% of the blood because you have to have a watery substrate for all these cells to float around in. So if you're dehydrated and you don't have enough fluids in your body, it's really going to affect not only your blood, but also your blood pressure as well. We need to have protein. So whether you're a vegan or vegetarian, you have to make sure you're getting enough protein because blood is a tissue and blood requires protein. They're cells of the body. So if we're not getting enough protein, that means we can't make the structures of our body. Vitamins B12, folic acid, vitamin C, vitamin E, vitamin K, all these things are needed for healthy blood. And we're going to go through some of these. Mineral, iron and copper especially. All right, so let's just go through each one of these. So certainly water, and I know I've shown this slide before. I really like this slide a lot, and I think that's why I put it up, because sometimes we get so overwhelmed with how much water we're supposed to be drinking, but this gives us the chart according to our weight. And that would, again, make so much sense to me because a person that might be 300 pounds would require more water than, say, somebody who's 100. So that's why I really like this chart. So I fall within this range, about 160 pounds. So I'm going to go for that 8 cups of water a day, or at least some sort of sugar-free beverage. All right, now let's talk about protein. So good quality proteins come from animal products. So eggs and chicken and seafood and steak, and let's see, um, deli meat, if you eat deli meat, things like that. So how much are we supposed to have? Well, when you look at the recommended ounces according to the guidelines for Americans, it should American population is eating way too much protein. And I think a lot of that is born the low carbohydrate diets and the high diets. Having too much protein isn't good for us either, because high protein diets actually overtax the kidneys. You have to really make sure you're drinking plenty of fluid because now you have to get rid of some of the metabolites of the proteins. If you eat too much protein, it can lead to uric acid, which could lead to gout. It could lead to kidneys, so too much is. So what I usually like to do, let's see if I put it on the next slide. I usually like to calculate protein according to my patient, whether you're a male or a female. So what I do is I look at what your weight is, your goals are, and then the magic number is to multiply your weight in kilograms by 0.8. So sometimes that might come out to 60 grams, sometimes it's 80 grams. It depends because it's going to depend on of that particular patient. And that to me, again, makes so much sense. That's more of a personalized approach to how much protein you're supposed to be getting as a human being. These are just general guidelines, though. Women typically eat between 60 to 80 grams of protein per day. On average, women eat about 76 grams of protein a day. And men, anywhere between 80 to 120 grams of protein per day. On average, men are eating about 110 grams of protein a day. So this is just an average. Now you might say, well, how do I figure out how much protein is in my food? We used to say, well, look at the palm of your hand, and the palm of your hand is about 3 ounces, but I never use that analogy because everybody has different sized palms. Believe me, I dealt with a football player. One palm was the size of both my hands. So he had a pretty big hand. So I look at a deck of cards. So familiar with deck of cards because we might be playing cards. So a deck of height, width, and length is about 3 ounces. So your goal really is to do about 3 ounces of protein per meal. And there's another calculation here. 1 ounce of cooked protein gives you approximately 7 grams. So for this 3 ounce portion, 3 times 7, 21. So that's just an average, but on average, a piece of steak or a pork chop or a 3 ounce chicken breast will give you approximately 21 grams of. The best thing though, and I've said this to you guys before, is track your intake, especially if if you have certain goals that you're trying to meet in order to see where you need to improve or scale back on, etc. And that's why I do like the MyFitness, pretty easy app of an exact number. I know sometimes I do this little estimate things in my first. Doesn't mean you can never have, you want to eat every day just because, the fat content is high. So you always want to choose the lean proteins first. That means if you're doing dairy products, we want low fat dairy. Chicken and turkey are extremely low in the fat category, so that's why they're very good proteins. Same thing with seafood and shellfish. If you do eat pork, we do encourage the white pork, not the bacon and the ribs again. Of course, you can do lean beef as well, like the tenderloins, the bisons. Those are very lean too. Anything that ends in the word sirloin is actually a pretty lean piece of meat. Soy and tofu are really great plant proteins. And what's really unique about soy and tofu is that it's almost like you're having a steak when you look at the amino acid profile. It is complete with the amino acids, which means it's a complete protein. So it's actually a very, very good plant protein. Pea protein is very good too. You see a lot of pea protein products and maybe protein shakes. They're not complete proteins, but they are good proteins. And then, of course, you've got the beans, which are the legumes, or the pulses, like the lentils, and nuts also have some protein as well. Unfortunately, we overdo the nuts because they're just so easy to eat. Before you know it, you just ate a whole bag of almonds. So you just have to be careful. Now, you're kind of killing two birds with one stone when you're eating some of these animal products because these animal proteins actually also contain vitamin B12, and that's very good for blood as well. We're going to get to that in a second. Now, fruits and veggies are always good to eat, right? And we're always saying, okay, well, why are they so good to eat? Well, we know that they contain fiber, so that's good for your body. We know it contains vitamins and minerals, and that's good for, anti-cancer. It's also good to protect your blood. What does it have? Well, fruits and vegetables, what's really interesting is when you compare the nutrients of fruits and vegetables, they're very similar, except fruit, of course, has the sugar component. But if you look at, say, broccoli and you look at an orange, they both have very high amounts of vitamin C and also folic acid. So you can really get very similar nutrients from both of these food products. So definitely eat at least, let's see, with vegetables, I try to encourage as many vegetables as possible. If you can do 3 to 4 servings a day, that would be ideal. And with fruit, kind of keep your fruit serving a little bit lower, maybe 1 to 2 servings per day, just because of the sugar content. Now, whole grains are really good for us too. And I know sometimes the grains and starches are scary for some people, especially if they're on a low carb diet or if they're following a gluten-free diet. But if you don't have any dietary restrictions like that, then the whole grains are good because they contain vitamin E, which is really, really good for our blood. So that's why if you do breads, crackers, pastas, cereals, try to do the whole grain because you're not just getting fiber, you're getting the wheat germ, which actually contains a lot of vitamin E, which actually protects the blood. And I'm going to show you in a minute how it actually does that. So I wanted to just show you this chart because it's actually new. It's the new dietary guidelines for Americans. These guidelines are published every 5 years. So if you didn't get a chance to take a look at it last year, this is what it is. And it gives you a nice guideline of calorie levels and then how many of these nutrients we should be having per day. So just say you're following a 1200 calorie diet. This is saying about 1.5 cups of vegetables per day, which is actually about 4 servings. But they even differentiate and say, you know what, we want you to have dark green vegetables. We want you to have orange and red vegetables because they have so many more nutrients. They have the folic acid and the vitamin C and the vitamin A, the beta carotene. Beans, peas, and lentils half a cup, starchy vegetables, 3.5, and then other vegetables. I'm not sure what they mean by that. I guess maybe onions and mushrooms, things that don't fall in these other categories. Fruits, look at this. They're telling you 1 cup a day. 1 cup a day. I remember showing this to one of my patients who comes from the Caribbean, and she's like, "Are you kidding me?" No, she eats a lot of fruit, but I think that's causing some issues for her. Grains about 4 ounces per day, and they actually differentiate and say, you know what, if you're going to do 4 servings a day, make at least half of it be whole grains. And the thing that I did like about this is that it doesn't tell you you can't have white rice or, white pasta, but if you can, and you have a choice, maybe go the whole grain route. That would be better. Dairy products, about 2.5 cups per day. Protein foods, this is 3 ounces. And it just kind of differentiates here in the oils, etc. So I thought this was just a really nice chart to kind of guide people on how much of these products should we be eating to meet calories, because that's always something that we're counting too. So let's look at some of these individual nutrients that keep our blood healthy. Of course, iron. That's what we always think about, iron. We don't need that much iron, which is good. We only need about 5 milligrams or 6 milligrams, depending upon your age. Also depending upon what you're doing in life. Certainly if you had surgery, you might need more iron. If you have certain conditions like that ulcerative colitis, or if you have bariatric surgery or anything like that, you might actually need more iron. But on average, about 5 or 6 milligrams per day. I wanted to show you this again. This is the lab from my patient. Her iron levels were good. This is the range. Her iron binding capacity was also good. This gives me an indication of how well the blood is working, and how much it's saturated in terms of oxygen. So everything looked good here. And then ferritin is how much iron you store in your body. So you always want to have a little bit of cushion. Just because remember, your body has to recycle blood. So you don't want this ferritin to be at 0. You don't want it to be under 20. You always want to have that little bit of a cushion. So when I look at a profile like this makes me very happy. Now, what's really interesting about iron in food is you have different sources. You have heme iron, which actually comes mainly from animal products. And then you have something called non-heme iron, which comes from vegetarian products. It doesn't mean that one is, better than the other. We should be having a combination of both. But I think when it comes to the body absorbing iron, the heme sources are much better. So if you're having, steak or eggs, which is interesting that they put eggs on this side. I have a feeling that was a mistake, because eggs really do have good iron, so that should be on this side. But if you're doing your fish, you're doing, your turkey and your chicken, those are really good absorbable iron sources. So if you're the type of person that says, look, I don't really eat red meat, I don't want to eat that, that's okay. If you're eating your chicken, your fish, that also contains good iron. And then for those of us who are saying, look, I don't want to eat any animal product, or I'm very choosy about what animal product, but I still need to get my iron, beans and whole grains and, spinach and things like that, those contain iron. I think the problem is the body has a really hard time to absorb it. So there are tricks of the trade. Like I have a patient who's a vegan, so she does a spinach salad. She really enjoys that, but I know she's not getting much iron out of it. So I told her to put a little bit of balsamic vinegar on it. And what that does is that helps to make the iron found in the spinach a little bit more absorbable for her. She actually has to take a supplement, but we're trying to do it also by her food. These are just some other iron amounts. I mean, look at this. If we only need 5 milligrams per day and I have half a cup of lentils, 11.2 milligrams. But again, how much of this are we absorbing? If you put a little vinegar or lemon juice or something that's acidic, with these things. It actually helps it to absorb better. This always makes me excited, right? Anything with chocolate makes me happy. So half a cup of unsweetened cocoa powder, 10.5 milligrams of iron. That's amazing. Sometimes we forget that cocoa powder comes from a plant, right? It's cocoa. It's just that chocolate, they put a lot of the fats and things like that. Pumpkin seeds, look at this, even peaches, dried peaches have iron in it. Raisin bran, seaweed, which is such an amazing food, cashews. So this just kind of gives you a nice idea. Now, copper is really, I think the doctors don't test copper as much as we should. And as a nutritionist, I'm a little nervous that we're going to see some higher levels of anemia, not from iron deficiency, but from copper deficiency. And the reason why I make that statement is because a lot of us are taking extra zinc to ward off COVID-19 because we know that zinc helps the immune system. The problem is that if we take too much zinc, it affects our copper absorption, and then indirectly you can induce an anemia. So I always get a little nervous about it. I always tell my patients and clients that if they're taking zinc supplements, they need to take a look at their multivitamin to make sure that it has copper in it, 1 to 2 milligrams of copper for every 15 to 30 milligrams of zinc. Certainly, before you take any kind of supplement, you need to talk to your doctor and pharmacist just to make sure it's not interacting with any of your medications. But this is just something I'm looking out for. But of course, let's look at food. So copper is found in oysters if you eat them. I just get nervous about oysters just because of some of the contamination. Lobster is always nice. Crab, cashew nuts, sunflower seeds, mushrooms, soybeans, trail mix, garbanzo beans. So there's copper in different foods. I mean, liver, a lot of people don't really eat liver anymore, but certainly if you do, you're getting a very good amount of copper from that food product. You're even getting iron as well. All right, back to our vitamin E. So why is it so important? We only need about 12 milligrams per day, but vitamin E is amazing because what it does is it protects the cell membrane of the red blood cell. So I'm showing you a picture here of a normal donut. It looks like a donut to me. That's why, of course I have to think donuts, right? But it looks like a biconcave donut disc, and it looks really pretty. For those of us that don't have enough vitamin E or a vitamin E deficiency, it causes a rupture in the cell membrane, and it causes the red blood cell to burst and to die. So that's why we need vitamin E. This type of anemia is actually called hemolytic anemia. Malaria does that as well. Now, vitamin E is a little tricky because, again, you want to eat it from food. You don't necessarily want to take supplements because if you are on other blood thinners like Plavix or warfarin, Lovenox, even omega-3s like fish oils, you have to be careful because vitamin E will decrease platelet clumping and coagulation. And that could actually lead to bleeding. That could lead to something called a hemorrhagic stroke, even if you take aspirin. So my recommendation is if you're taking any kind of blood thinner meds, don't take a vitamin E supplement unless you talk to your doctor or pharmacist, unless it's prescribed to you. As a matter of fact, there is an upper limit for vitamin E, and that's 1,000 milligrams per day. So my point in saying this is that, sometimes we think vitamins are innocuous substances. We know that they're important for us, and there's such a big push to take over-the-counter vitamins and minerals. I mean, you can get anything practically over the counter in different dosages, but it's not necessarily the safe thing to do. So always be careful with that. But on the flip side of that, rarely do I find a problem with eating food that has vitamin E because you just wouldn't be able to eat too much food to get too much vitamin E. So good food sources of vitamin E would be any of the oils any of them, olive oil, coconut oil, canola oil, walnut oil, any of them contain good vitamin E. And that includes nuts too. So obviously that makes sense. If you're eating walnuts, you're getting vitamin E. If you're using walnut oil, you're getting vitamin E. Certain vegetables like spinach and green leafy vegetables, even peppers, olives, that would make sense too because of olive oil. Certain spices like paprika, kind of like that, dried apricots. So all of these are very good sources of vitamin E, and even whole grains as well. So this just gives you a nice chart. Like, look at this one, wheat germ oil or wheat germ, which is such an amazing product too. But look at this, 20.3 milligrams. So a lot of stuff. So you can, and most Americans do get enough vitamin E from their food, just because these are things that are eaten in abundance, even, the oils especially. Now, I wanted to bring up vitamin K. Vitamin K is a very interesting vitamin because we make it. Our body makes it, except newborn babies. That's why newborn babies, we have to give a shot of vitamin K. And then once the microbiota and the microbiome, which I think we talked about once before, it actually helps to create vitamin K. Vitamin K rich foods, all the green leafy vegetables, anything that's green contains vitamin K. And vitamin K is really, really good for not just our blood, but also for our bones, believe it or not. There was this big, huge nurses study, and what came out of that was those nurses that were deficient in vitamin K actually had higher risk of osteoporosis. So vitamin K is a vitamin that we make. That's how important it is. It's important for blood clotting. It's important for our bones. That's why some of us, if we are taking blood thinners, sometimes the doctor and nutritionist will tell you, look, you got to hang back on eating a lot of very vitamin K rich foods because it can counteract the medications. But if you're not on those meds, go for it. Have your avocados, have your green apples, have all your green stuff. We don't need that much in terms of the reference intakes. If you're taking a multivitamin, it probably has it in it too. But as you can see, vitamin K is found in many, many different foods, especially the fruits and vegetables. So another good reason to have fruits and vegetables in our diet. All right, this is our B12. Now, B12, like I mentioned, I don't know why they put mushrooms here because B12 really isn't found in mushrooms, but it is found in these animal products. And I don't know, is this oatmeal? It's not really found in oatmeal unless it's fortified. This is actually the reference from my patient, and she was actually high in vitamin B12, and that's because she was taking a supplement. And what's interesting about vitamin B12 is it's a water-soluble vitamin that stores in the liver. So that's why I don't like for patients to take too high doses of B12. And vitamin B12 is actually one of the most abused vitamins out there because you can buy them in very high doses. Sometimes doctors will give you injections every week. Some weight loss clinics will do that. Some people think that it gives you energy. Indirectly, it might give you energy just because, you got healthy blood. So you're oxygenating your body. So you have energy. But really, vitamin B12 is needed for also for healthy nerves as well. So again, as you can see, you don't need much. Okay, but why are we at risk of vitamin B12? Vitamin B12 has a very complicated digestion and absorption. And it's a very special vitamin that when we eat it, so just say you're having your piece of steak and you're eating your vitamin B12, your body actually has to cleave the vitamin B12 from that protein and attach it to something called intrinsic factor. So it's this other friend that's found in the stomach, and it joins together with that B12 to allow for the absorption. So if you have any problems with your stomach, if you've had stomach surgery, if you're on acid reducers, Um, if you have diabetes and taking metformin, metformin actually is shown to decrease B12 absorption. If you have ulcers, if you have something called Helicobacter pylori, which causes ulcers, all of that can actually decrease the amount of B12 that you're able to absorb in the body. Certainly, if you're a vegetarian, we know that. Certainly, if you can't get a hold of some good food, you have food insecurity, all of that can do that. So vitamin B12 deficiency is actually more common than we think. And as we get older, just because, our body isn't working as well as it was, we might not be making that intrinsic factor as much. So that sometimes is an indirect cause of that anemia. So we're taking B12 or we're eating B12, but we just can't absorb it all that great. So good sources of B12 would be your animal products. I always encourage my patients, especially the ones over 50, to ask their primary care physicians to test for vitamin B12. And the deficiency of vitamin B12 is so extremely dangerous. Not just anemia, but also nerve disorder as well. You can end up with something called peripheral neuropathy. So most doctors, certainly in the wellness checkups, I think that's even part of wellness checkups, what I've been noticing. So if you haven't gotten your B12 tested lately, ask your primary care for that one. Folic acid works together with vitamin B12. And what's interesting about folic acid is that it's not found at all in animal products. It's only found in plant products. So again, another reason to have your fruits, your vegetables, your whole grains, because then you'll get some really nice folic acid. Folic acid is really an amazing vitamin as well because it's healthy not just for your blood, but also for your heart. Folic acid actually helps to regenerate a metabolite called homocysteine, which is actually a natural metabolite of digestion. And if you have very high levels of homocysteine, that hurts your heart. So that's why folic acid is really good for us. It's usually in multivitamins, but if you're not taking a multivitamin, just make sure you're really enjoying those vegetables and those fruits. You don't need that much, only 400 micrograms. If I have anybody on the call that actually wants to get pregnant, then you're going to actually need more than 400 micrograms. Oh, there we go with that beef liver. Even though I said it's not found in any animal products, it looks like beef liver almost contains everything. But I don't know if I would really eat beef liver these days, just because remember, what does the liver do? It filters the blood, which means it's filtering everything, the good and the bad. Spinach, black-eyed peas. Most of our grain products are fortified. That means that the industry adds the vitamins in. So, your cereals, things like that. Oh, vitamin C. Vitamin C is the second most abused vitamin on the market. So we don't need that much, 75 milligrams per day. Men need 90 milligrams per day, unless you're a smoker. Smokers, we usually encourage to go up to about 250 milligrams per day, just because smoking really wastes vitamin C. And our body does not make vitamin C, so we have to eat it. Vitamin C is an antioxidant. So that means it's going to protect our blood just from oxidation. Vitamin C is also an anti-cancer. So it's a really amazing vitamin, but it's also called ascorbic acid. So if you go to the pharmacy because you're afraid of COVID and you're buying 5,000 milligrams of vitamin C, oh my gosh, that's a lot of vitamin C. And that could lead to gastritis, that could lead to kidney stones. So again, too much is not good. Our body can't absorb 5,000 milligrams per day. That would just be overtaxing the system. So again, let's just look at food. Oh, there we go. So here I wanted to show you that actually the government actually established an upper limit for vitamin C at 2,000 milligrams per day. So if that's the limit and we're doing 5,000 milligrams per day, that's really not a good thing to do. So just look at your food, like your fruits, your vegetables. And what's really cool is that we always associate vitamin C with citrus fruit, but you know what? It's in strawberries, it's in peppers, it's even in potatoes. So, if you're eating a variety of these plant products, you're getting a variety of vitamins and minerals. And that's why that really is the key to good health, eating a variety. So I think, what is our take home message with this blood? Well, healthy blood is essential for a healthy body. We don't make enough blood, or if our blood is unhealthy, that's going to lead to conditions. Diet does have a direct relationship to keeping our blood healthy, especially those nutrients that we discussed. Always think lean, so lean proteins, always think variety, because we don't want to get bored either. And plant products are really, really good for us. But just as a caveat, fruit, we do want to limit it just because of the fructose, which isn't good for us. And definitely drink water, or at least some sugar-free, calorie-free beverages. And when you get your labs, ask your doctor or nurse to actually review them with you. I think, just being in healthcare, I think one thing that we do is, if we see everything's normal, we just say, oh, yeah, yeah, don't worry about it. Everything came out normal. But, how about sitting down with the patient and actually saying, let's look at your results. Let's take a look at them. Because even though things might be normal, maybe they're suboptimal. Maybe there's a way that we can make it better. So that's why I always enjoy going over lab work with my patients and clients, just so we can see, is there any way that we can make things better? And of course, my sons. And then I thought it would be fun. Let me see if I can get, let me see. So I had this word search that I wanted to share with you. So this would be kind of fun to do, but too bad we're not together to do it. But this was one of these, I love word searches. And when you do word searches and crossword puzzle, that actually exercises your brain and keeps dementia and Alzheimer's away. So this is just a little word search on anemia. So let's see if we can find any of these things. I'm usually pretty good at it. Okay, so this first one is blood. Does anybody see it? Okay, so you might have to turn your mic on if you see it. Okay, I don't see it. And
Third line from the bottom, and it's backwards.
Oh, there it is. Very good. Okay, let's see if I can highlight it. Very good. Ooh, there we go. Blood. Oh, well, that was my highlighter. It didn't work so well here. Okay,
You
let's
got the
see.
gist.
But you got the gist. There we go. Okay, so we did that one. How about body? Okay, let's see. Body. Oh, I found it. Did you guys find it? Here it is. Body. There we go. All right. How about cancer? Okay. Let's see. Cancer. Oh no, that wasn't it. I got all excited and that wasn't it. Mm-mm-mm. Oh, I found it. Come on. Are you guys playing? You see it? Ah, there it
You got
is.
it when you did.
Ah, okay. There we go. All right. Carries. Okay. Carries. What's that have to do with anemia? Okay. Carries, maybe oxygen. Blood carries oxygen. Is that what they're talking about?
Oh,
Okay.
I got it.
Oh, you
Third line
got it.
from the third line from the top, the
One, two,
C,
three.
and then goes on an angle backwards, like
Oh, right
diagonally.
here.
Yeah.
Oh, very good. You got some good eyes. I got my contacts in. I can't see with them. I can't see without them.
My face is like pressed up to the screen. So.
Oh my gosh. All right. How about cell? Sometimes these little ones, you think they're the easiest ones, and that's the hardest one to find. Cell, like red blood cell. Mm.
Hmm.
Mhm. All right. Does anybody see it? Oh, and this is large print too. Can you imagine? Mhm. Ah, I found it right here.
Oh, nice.
Here we go. All right, this highlighter is kind of weird. Okay, chemotherapy. All right, that's a big one. That's got to be chemotherapy. Oh, I already found it. I guess the big ones are good. Those are easy. You figure they're either going to be or around the borders or, oh my gosh, that's a big one here. Chemotherapy. What's sad about chemotherapy is that it really does affect the red blood cells and the white blood cells. So it's a necessary evil, I guess. All right, colony. Is that what that says? Colony. I'm trying to think. All right, how would we relate colony? Well, the white blood cells will kill the colonies of bacteria. Maybe that's what they're talking about. Mm. Oh, it looks like people are getting off. They're like, they don't want to do, they don't want to
Me and you
do
are the
it.
only ones playing right now.
Oh boy.
Who else is there?
Well,
Judy,
Judith.
Judy,
All
help
right.
us out.
Woo, Judith. Excellent. Oh boy, oh boy. Well, Judith, if you are interested in this handout, I sent it to Jamie. She can email it to you.
I can, I have it.
There we go. And actually, I think here's the answer key.
There we go.
Oh, look at that. But thanks for hanging in there. This was a lot of fun. Hopefully everybody's going out to have a nice green salad to keep that blood healthy. And I think next week, what are we talking about next week? We are talking about
It is still in the healthy immunity. I don't have it on me at the moment, but
Okay.
will be sending the email out Monday for everybody.
Oh, excellent.
I just composed it this morning, but I don't remember.
Oh, excellent.
Sorry.
Actually, I think I have a handout for next week already. Should I send that to you?
Yeah, go ahead and send it to me. And then we'll see how we can get that to everybody, or just maybe put in the email if you're interested in attending. Email
Okay.
Jamie to forward to them. So.
Cool. That sounds
Cool.
good. All right, Judith. Did you have any questions, Judith, before we log off? All right. Excellent. Well, thanks so much for attending. And thank you, Jamie, as always, for being a great moderator. And I will see you next
Lillian.
week.
All right. Thanks, Judy. Good to see you or have you there. And thanks, Lillian. Have a good evening.
My pleasure. Have a
Okay.
good one.
You too.
Bye-bye.
Bye.